when I was on the hospital side, we had a mantra for first-time attendings coming out of training. So I'll tell you what we say behind the scenes as a hospital exec. I want to get a new physician, whether it's a first-time attending or new to my hospital. I want to get them as busy as possible, as quickly as possible, for as cheap as possible. That's the mantra. And I think if physicians understood that that's how we talk about them behind closed doors, that it would be far less trepidation for them to say, like, I understand that negotiating is a normal part of the process. Any wiggle room in the base salary, signing bonus, and patient contact hours?
Welcome to How I Doctor, where we're bringing joy back to medicine. Today, I'm joined by Ethan Nkana, a former hospital executive turned physician advocate. After more than a decade negotiating contracts on behalf of health systems, Ethan saw how often doctors were undervalued and underpaid. So he switched sides and founded Rocky Mountain Physician Agency, where he helps physicians negotiate smarter and secure the compensation, benefits, and autonomy they truly deserve. He calls himself the Jerry Maguire for physicians. Ethan believes that although physicians train like professional athletes, we too often sign contracts without the same level of representation. I'm so excited to talk with Ethan today because I think he really brings a perspective most of us never get to see: the inside playbook hospitals use when writing our contracts, and now the results he's delivered for physicians on the other side. He's here to show us what the traps are, how they're hidden, what's really negotiable, and how to stop leaving money and leverage on the table. Ethan Nkana, welcome to How I Doctor.
Hey, Dr. Walker, I am so excited to be here with you today. Looking forward to the chat.
Ethan, can you give me like the 60-second story on how you just started working for hospitals in the first place?
Yeah, actually, I got into it because initially my mom, who's a physician, anesthesiologist, she encouraged me to get into medicine, not realizing I wasn't smart enough to be a physician. And so my kind of workaround was to go to the administrative side of healthcare and hospitals. And I spent the first 15 years of my career working exclusively in hospitals.
Wow. I think that's such a common story. People with physicians, nurses, pharmacists in their family, they see the industry as something they want to be a part of. I'm not sure if you're, I'm not sure that you're less smart for not going into medicine these days. Ethan, was there a story behind why you decided to switch sides and start representing physicians?
In 2019, I was working for a large multi-state health system and unexpectedly got laid off, which for me personally was my biggest professional fear.
Yeah, sure.
And through that process, I was thinking, well, one, I don't want that to happen again. So immediately, like after I got laid off, I started to have this idea of, well, why don't doctors have agents like professional athletes? And as you alluded to in the intro, you follow these similar training journeys. They both go pro after residency, fellowship, or college. And athletes hire agents to represent their interests, but physicians a lot of times DIY it. And I saw from the other side of the table that physicians were, in a lot of cases, being exploited. And so that's what inspired me to start this practice advocating exclusively for physicians' interests.
Since you've been in that room, can you drill down and give me specifics? Like when you say physicians getting taken advantage of or not earning what they should earn, what does that look like?
What I tend to see is many physicians find out the hard way that medicine isn't what they thought it was going to be. And it's actually a business. And the way you run any profitable business is you increase revenue and you reduce expenses. And what many physicians come to believe, which is not true, is I am an expense and I'm a dispensable expense. And that leaves many physicians feeling disillusioned about this career that they thought was founded on helping people, which in theory it is. And the people who are making medical decisions now are not the same people who were making medical decisions 15, 20 years ago. Now it's MBAs and CEOs. And so I think many physicians on a foundational level are finding themselves, frankly, discouraged, disappointed, disillusioned that this is actually about dollars and cents and not about curing and creating healthy patients.
Is it really the MBAs are just looking at this as fundamentally a business? This is just a we're in the black or we're in the red decision?
I can only speak from my experience, and which I
Yeah,
think extrapolates out to the broader healthcare environment. My experience is only in nonprofit, faith-based hospitals. So other than maybe like, safety net hospitals like your county
sure.
hospital,
Yeah.
that's the closest thing that you'd think like altruism that there is, right? But I could tell you down to the dollar how valuable my physicians were to the hospital. That was my job. My job was to quantify Dr. Walker's revenue and then resultingly the profit that we make off of that physician. And I think I actually had this conversation on the way into the gym this morning with the physician who's going through a bit of a crisis. And I told her, I said, you have to understand that while you see this as your calling, as a passion, at the end of the day, it's a business. And the only difference between, and this is a really broad stroke, but the only difference between a for profit health system that you might see as like the big bad wolf, so to speak, and a nonprofit health system is what they do with the profit. This is what I tell physicians all the time. If you think this is a mission, if you think this is altruism, spend more time with your patients. Take the weekends off and see how that goes for you, right? Dr. Walker, you're going to be getting a phone call.
I'm laughing because I know exactly what that means. Yeah.
You know
Yeah.
exactly what that means. But inevitably, physicians I talk to are giving everything of themselves for their patients because no physician has ever called me and said, Ethan, I want to make more money. In 5 years, that has happened
Yeah.
a
Thank
total of
you. I totally, yeah.
zero
Yeah.
times, Dr. Walker. But what does happen is physicians tell me, Ethan, I'm on call every single night with no backup. I can't take a vacation. I don't get to see my family. I spent extra time with patients and I get penalized for it. Those are the things that physicians call me for.
We just interviewed Dr. Danielle Ofri. She's a well-known physician writer. She wrote this article, "The Business of Healthcare Depends on Exploiting Doctors and Nurses." And she and I spoke similarly that, the system doesn't care about you. It doesn't care if you get your vacation. It doesn't really care how many hours you work. It just wants to get its profit from, extract its profit from you.
And you can dress it up with mission statements and we care about the holistic. That's all great. But at the end of the day, the health of your patients is dependent upon having healthy, happy, fulfilled physicians. So I know it's a little bit hokey, but when I think about my work, I work for the patient. And if I can help physicians be more balanced, happier, less burnt out, then ultimately the patient's going to benefit from that.
Yeah, that's, I think, exactly how we think about it at Off Call. Money is one factor that people consider when taking a job, but it is far from the one that makes them decide to stay or leave a place. It is how well they feel supported at their hospital by their administrators. Do they feel burnt out? Are they happy? They have good relationships with their nurses, with their patients, with their consultants. Are they spending 3 hours a night at home writing charts? It's all of those other factors that we're trying to quantify or capture or record, because it's not just about the money. You could take two physicians making the same amount of money, the same hospital, and one could love it and one could hate it because of just the environment of care, really. Let's kind of shift and reframe this. If physicians should not think of ourselves as on the cost side of the ledger, but as the revenue generating side of the ledger, or the side of the ledger that helps drive health and keep patients healthy and arguably even get patients through the health system safely, what does that look like? How should we be thinking of ourselves and what value we bring to healthcare?
I don't know that I want physicians to have my disposition and be motivated by money. I don't think that would, make for any better of a healthcare system than what we currently have.
Yeah.
I think what I would say is for the average physician, and I mean the physician they come in, they do their job, they don't want to be, a leader, a CMO or CEO. They want to, just do really well at their job. I think for those physicians, my guidance would be don't stay in a toxic situation any longer than you need to. And I say need to specifically because a lot of physicians, I'll hear them in these. One physician I talked to recently out of New York, she had her pay cut in half and was still thinking about, well, how can I make this work? Right? Because if you cut my pay in half, that's my last day on the job. But for her, she was thinking, how can I make this work? How can I navigate this in a way that doesn't desert my patients? And so I would say to any physician who is in a tough situation, if you think it's going to get better, what evidence is that based on? Many physicians I talk to are evidence based practitioners. What evidence do you have that's going to get better for you? If anything, you're going to see pressure increase, you're going to see workload increase, you're going to see less time with patients. So I would just say for any physician who's in a toxic situation, just please, for the sake of your patients and your family, is like don't stay in a toxic situation longer than you need to.
It was interesting. I was at a wedding this past weekend, and I was talking with a physician assistant or associate, whatever I'm supposed to call them now. He told me that all I think the PA society like collects salary data on them, and it's like a yearly thing. He said, I think it might even be a requirement, like for me to like renew my certificate or license or whatever, I have to do this. And it is interesting. I thought of, PAs understand that they are probably going to be employed to do a certain amount of work per year. And there's going to be a contract that says what that work is and how many hours and blah, 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 and how much money they'll make. The way things are framed for physicians, oh, well, you went into this because you want to help people. And so in some ways, I wonder if some of the other like PAs may be more savvy at either negotiating this or understanding it because they're not given a false pretense into how the healthcare system or the business of healthcare works in the United States of America.
Yeah, that's a really insightful point. And I would ask, like, if PAs have that awareness, what stops physicians from having that same awareness in your mind?
I have no idea, and that's why I started off call.
So, to exactly your point, there are other healthcare practitioners. I'll call them providers. I will never call a physician a provider. I'll call those clinical folks providers. A lot of them will advocate for themselves. But when it comes to physicians, sometimes I'll be sitting in a room with clients. Most recently, it was a group of OBGYNs. And I said, well, you guys have a 10-year contract. You're halfway through, there's zero pay raises. What do you think would be fair from here? And you should have seen how uncomfortable they got. I mean, squirming around.
I'm
I could
already
tell
I'm
you a
already
lot more.
squirming. Yeah, yeah,
Oh, yeah, exactly. Like just vicariously through them, right?
yeah.
So for physicians, there's just this disconnect with appreciating not just the importance from a health perspective of what you do, but also the economic value of the work that physicians do.
Yeah, I mean, I'll answer your question a little bit more honestly. I think number one, we break ourselves down by specialties, and it's not only is the physician role very close to our identity, our specialty is close. Like,
Mm.
I trust an ER doctor more than I trust a neurologist or something. No offense, neurologists. But we kind of have our clans, our group, our people. And generally, we have our group that we agree with and work with really closely. And so I think physicians as a whole maybe don't feel as united that we are physicians first. Like I think we feel that we're cardiologists first and then a physician second or something like that.
Oh, interesting.
And then I think I was talking with a financial planner on our podcast, one of our first episodes, and he said nothing in physician pay or finance or even healthcare finance is all that complicated. And if you can't understand it, or if you're made to feel bad about trying to understand it, that is intentional. And the obfuscation and lack of transparency in the system does not benefit the individual employees. Transparency benefits the the people that are being employed as well.
Yeah, that's a completely comprehensive thought, and it echoes some of the things that I hear from physicians on a regular basis. But it breaks my heart when I see physicians go through these horrible situations, and they still. One physician executive out of Philadelphia actually told me as he was going through the negotiation, he's like, "Ethan, I feel like I have Stockholm syndrome. It's like I know I deserve better, but I want to do right by them."
Yeah. It is, Ethan, it's such a good question. I'm sitting here thinking like, yeah, I would totally squirm as well. We should dial in my therapist right now. We all signed up and took this oath that we're going to put our patients first. And my theory is that most of us think that taking the Hippocratic oath means that like our needs can't matter or they don't matter at all. And I think what the Hippocratic oath is supposed to say is like our patients' needs come first, but that doesn't mean that our needs don't matter. And so the idea that if I'm an OB and I'm uncomfortable talking about money, I think physicians need to reframe that as, look, I provided a really important service to help my patients. I'm confident that I'm providing that service well and I really help my patients. That's what I signed up to do. And that whether it's my employer or my med group or society should value that.
That all sounds very reasonable, Dr. Walker.
Ethan, let's maybe dive into some of your experience with negotiations, if that's okay.
Yeah, let's do it.
When you look through contracts, when you talk with physicians, what are the three most common ways that hospitals quietly take advantage of doctors in contracts?
I'll tell you what it is not. It's not money, as I mentioned a few moments ago. No physician in 5 years, and I've talked to thousands of them, no physician has called me and said I'm underpaid. It just doesn't happen. So when I hear this idea of like physicians have egos and blah, 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 fine, but it's not about the money. It might be about their knowledge of their expertise or their specialty, but it's not about money. So I would say the thing that I see most frequently is physicians doing volunteer work on the clock. So the paradox that that creates is a physician is sitting on committees, a physician is leading programs, a physician is doing outreach. And then at the same time, the MBA sitting in the ivory tower calls the physician and says, "Well, Dr. Walker, looks like your RVUs are down. Looks like your collections are down a bit. What's going on? Are you slowing down?" And you say, "Well, no, I'm doing the other 50 things you've asked me to do that
Yeah.
that don't generate revenue, right? Or RVUs." And so I'd say the one of the biggest things is that physicians are doing volunteer work on the time. I love it when my physicians volunteer their time, but volunteer your time on your time and where you want to, not doing charity for the place that's supposed to pay you for your services.
Volunteer your time on your terms.
Yes, volunteer your time on your terms. I love that's a
Yeah.
perfect way to put it.
Yeah.
And a lot of physicians do that in addition to already, being overworked. I would say the other thing that I tend to see is physicians being penalized for providing good care. Now that sounds paradoxical, but what I mean by that is if you would say, "Hey, what leads to good care? Does more time or less time with the patient lead to good care? Does more communication or less communication with a patient?" Like you would say more, right? But every time a physician calls me and talks about their time with the patient, it keeps getting chopped down. Now we're doing 30-minute visits. Now it's 20-minute visits. Now it's 15-minute visits. Now I'm double booked just in case someone doesn't come in and you're going to see back to backs. So, this idea that it's about the patient, it's about quality. Sure, those might be numbers two and three, but revenue's first, right? Revenue is always going to be first. I'd say, lastly, physicians often the bare minimum they want, in my experience, is a seat at the table. They just want their voice to be heard, not so that they could be paid more, but so they can advocate for their patients, right? But when I talk with some of these physicians and they say, "Ethan, we have a," and I despise this, but they'll say, "We have a monthly provider meeting," which I'm not calling them providers. That's what the hospitals will call them. We have these monthly provider meetings, and then our physician section is the last 15 minutes, and we never have time for it because we have a packed agenda on all the other things.
Yeah, we run
And
over
so
and they cancel it, and yeah, yeah.
we, as I can speak for myself as a hospital exec, we think the hospital's lights stay on because of us. I promise you, there has never been a hospital in the history of hospital that have been run by an MBA without MDs. And if physicians knew, like, if you stopped your work, the system would come to a halt.
Yeah.
But you've already alluded to it. That is antithetical to the Hippocratic Oath, which you all have given your lives to. So that is, I think, fundamentally how the business exploits physicians. At least one of the ways. There's many others, but we don't give physicians a seat at the table. And then people like me, MBAs, are making clinical decisions on what's best for the patient.
Ethan, you said three things. You said people volunteering their time and then getting kind of penalized for that, getting penalized for wanting to deliver really good care because the time is shrinking. And you said just wanting a seat at the table, wanting to be heard. So what are people asking in their contracts to combat these, or how can you help them with those pain points they're feeling a lot?
If I could fix one problem for physicians, it would be just don't stay silent when you're suffering. Just speak up and say, I can't do this. Because ultimately, a physician, like when I look at contracts, I mean, there's a bunch of eggheads out there who will talk about, oh, non competes, pop, 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 and, recitals. To me, physician contracts have three main components: your life balance, so your schedule, all of that, clinic, surgery, call; your practice support, professional development, so who's supporting me, my equipment, my staff, in clinic, out of clinic; and then lastly, fair pay. So those are the three buckets that I'm thinking about. Physicians always have the pain points in the first two, and then I need to encourage them to address the third one. And
Yeah.
I cannot tell you, Dr. Walker, how many times a week I hear the G word, the word greedy. Ethan, I don't want to come across as greedy. I don't want to sound greedy. Stop it. Stop it. I'll be greedy for you. That is a dirty word working with me. And I tell physicians it is not greedy to expect to be paid fairly for your s- incredibly valuable skill set.
Yeah.
But physicians just cannot swallow this idea of, like, there's a high level of economic value to what I do, and I deserve a fair portion of that.
Yeah, thanks for saying that. I mean, it's one of the reasons I started off call. We are trying to collect anonymized confidential data from individual physicians. They can say what state they're in, what their specialty is, their pay, but also so many other things besides their pay. It's how many hours per week are you actually working? Not just the number of, not just 9 to 5, but are you going home and writing notes or responding to messages for 2 hours at home? At least we should know that comes with this job.
It made me think of, like, when we're dieting and we're jotting down our calories and we get to the end of the day, like, dang, I didn't realize I had, two ice cream bars. Like, I was
Yeah.
eating mindlessly,
Yeah.
but you're kind of like surprised by that number. And I think if physicians actually took the time to do what you're saying, they would be disgusted.
I totally agree with you. No one is saying, I'm going to use off call because I want to go get paid a ton more money. I think people are trying to say, hey, what is fair? Oh my gosh, I'm getting paid $50,000 less than the average in my state, but I'm also seeing more patients per hour. That's not making sense. That doesn't seem fair. I truly just think physicians want to make sure we're not getting like suckered and taken advantage of more than anything. In your experience, are hospitals paying physicians differently? The ones that are negotiating, are they really making more, or are hospitals kind of keeping everybody in the specialty paid the same?
No. So there is no parity among physician pay. And I often say that it sounds crude, but it's really the way things work. The physicians who get paid the most are not the best physicians. The physicians who get paid the most are the physicians who speak up. And so I use that crude example of the squeaky wheel gets the grease. So those are the physicians that you see getting pay raises or improving their conditions, whether it's my support system, my clinic, outpatient clinic office, or my schedule. And the physicians, unfortunately, who just tolerate it and just like suck it up because like this is what you signed up for, those are the physicians that ultimately find themselves in a really, really tough situation where they either have to take a break for physical, mental, emotional reasons, or they are putting themselves at risk or their patients at risk.
Ethan, I had to jot down what you just said. The physicians who get paid the most are not the best physicians. I mean, that gets back to this concept of fairness,
Yes.
right? I'm not trying to make more money than other people, but if I am arguably have whatever the best quality metrics and the best the best patient satisfaction, and I'm always on time, and I'm closing my charts on time, and I'm doing all the things, that certainly would not seem fair for another physician to who's arguably doing worse to make more money than I am just because they decided to speak up, and I'm just have my head down and I'm just working all day.
I want to just deconstruct this stigma that physicians are greedy because they want more. And physicians tell me I'm not calling them greedy. That's what they say is I don't want to be seen as that just for being paid fairly.
We've received a couple emails, kind of anonymous emails from physicians who signed up with off call, who've told us that HR has like accidentally emailed out the salary list,
Uh-oh.
that it was supposed to go to somebody else and it went to the whole group or
Uh-oh.
something like that. And they double click that Excel spreadsheet and see there's like a $50,000 spread between two physicians who they're like, I'm doing the same amount of work as that other person. How do you think people would react if they were able to see how much money their colleagues were making?
I've seen this happen in real time. I saw this happen when I was on the hospital side. And one of my coworkers, again, I was a finance guy at the time, she found a spreadsheet exactly like you just said. And within a week or two, she was having a meeting with the boss to update her pay. From the physician side, I would see them explaining it away. Well, that's Dr. Jones, and Dr. Jones,
Is really good. Yeah.
he's really, really good. Like I'm good, but Dr. Jones, he's really good. I think physicians would feel it for a moment, and then that quiet voice would say, "You do it for the money, Dr. Smith? Is
Mm.
that what you're here for? Like, you chill out. Like, you don't do it for the money. You do it for your patients." Well, yeah, you're right. You have a nice car, a nice home, and your kids are in a good school. Yeah, you're right. So I think physicians would accept it as a reality of the circumstances for some ethereal reason that makes sense to somebody somewhere.
Yeah. Do you get the sense that health systems or hiring people ever kind of subtly plant those ideas in physicians' heads?
When I was on the hospital side, we had a mantra for first time attendings coming out of training. The same first time attendings who say, "Well, Ethan, I don't want to rock the boat. I really want to go there. It's really uncomfortable
I'm a
to,
team player.
I'm a team player." So I'll tell you what we say behind the scenes as a hospital exec. I want to get a new physician, whether it's a first time attending or new to my hospital. I want to get them as busy as possible, as quickly as possible, for as cheap as possible. That's the mantra. And I think if physicians understood that that's how we talk about them behind closed doors,
Yeah.
there would be far less trepidation for them to say, like, hey, I understand that negotiating is a normal part of the process. Any wiggle room in the base salary, signing bonus, and patient contact hours? Right? It doesn't have to be adversarial. Like any negotiation I've been in, even with these national for profit health systems, never once have I gotten to a shouting match. Never once have there been papers slid across the table upside down. That never happens. It is always about the facts. These physicians are really good, they're really busy, and they're really valuable.
Ethan, is data and information asymmetry one of the ways that physicians get taken advantage of, in your opinion?
1000%. And that's why I love what Off Call is doing to, I know these aren't your words, but apologize if this doesn't fit, but I
Oh,
love the way that Off Call democratizes that data.
yeah, that's what we're trying to do. Yeah.
Yeah, because I think more physicians would feel confident if they had the data to support their position. You must get the data. And that's where one of the largest gaps is. Now, you can't just take the data, plop it on their desk, and think you're going to get a pay raise, but the data is essential to understanding, are you even in the ballpark of what you should be getting, what's fair for your specialty, geographic region, and experience.
What's the most common piece of advice you give physicians who want to negotiate, and the advice that actually works?
Don't stop at no. The first answer will always, always, always be no, or a proxy for no. A proxy for no is it's not in the budget. We're going to exceed fair market value. Oh, we'll
Oh, I've
start
heard
getting
I've heard that term a lot. Yeah. Yeah.
Of course you have. If you've been practicing more than 10 minutes, you've heard it, right? And I think the my favorite one, my absolute favorite, Dr. Walker, is when I go into to negotiate on behalf of a group with a CEO and say, "Hey, the group is super happy. They want to stay here. They want to stay together. They just feel like their contract doesn't quite match up with what the current market is." Inevitably, that CEO will look me in the eyes and say, "Ethan, if we pay them one more dollar, we're going to end up in orange jumpsuits." And to date, we've gotten multi-millions of dollars for physicians on an annual basis. And shockingly, no CEOs have gone to prison yet.
What? You don't say.
It's shocking. I know, color me shocked, but none of them have gone to prison. If anything, they threw parties to celebrate retaining their favorite physician group.
Yeah.
Weird.
How do physicians know what they're worth to the hospital? Is it calculating your RVUs and multiplying by a number? How do I
Oh,
know?
man, we could do a whole episode on that.
I'm sure. Yeah.
So I'm gonna sum it up with physicians won't know because I, as a hospital exec, protect that information with my life. Because if physicians knew what they generate relative to what we pay them, they would just walk out. Like they wouldn't work for us anymore. Or there would be a mutiny and they'd all be at the CEO's door pounding it down. On the hospital side, you're thinking about that really big, crazy number called charges, right? And then that dwindles down to actual collections, what you get back from the insurance companies. But what I can tell you, and Merritt Hawkins published a report in 2021 that measured the volume of physician business and the financial impact of that relative to their pay. If doctors knew that there's some egghead in a cubicle somewhere like me crunching numbers, and my CEO is saying, "Ethan, how much can we pay Dr. Walker in order for us to get our return on investment in 6 months?" Nonprofit, faith based healthcare, we're having those conversations. It's about the money. It's not about the money to physicians, it's about money to the business. And I often, when I meet with physicians for the first time, one of the things I'll say is, "Well, do you know how valuable you are to the practice?" "Yeah, I'm really valuable. They really like me. I'm a really good doc." No, no, no.
I work
Do you
really
know how
hard.
valuable?
Yeah.
Yeah, I work really hard.
I
I'm a
cover
team
the night
player.
shifts. Yeah.
My
Yeah.
patients love me. I couldn't help but laugh. I had one guy who was like, "Ethan, they love me. I'm an executive. They put me in commercials. How much do they pay you?" Duh, well,
Well, I
with
just
my
do it.
face.
Yeah.
Come
Yeah.
on. I mean, again, I adore physicians. My mom is a physician, so I see this as more
Bless
than
your
just my
heart. Yeah.
I see this as more than just my job, right? I
Yeah.
love what I do. I genuinely do. And I spend an hour on the phone with a doctor who was in a crisis morning. I love that. And I know that it's just like there's more than I can solve myself.
Do you have a relative number for how much the physician is generating in revenue for, whatever the outpatient health system or the inpatient, health system relative to their pay? Is there a standard number that might help physicians understand, like, hey, you're getting paid like a tenth of what the hospital's getting back from you?
This is that Merritt Hawkins report
Oh
that
yeah.
I was telling you about just a moment ago. So this report was published. I lied earlier. It was published in 2019. And it's called the Physician Inpatient Outpatient Revenue Survey, again by Merritt Hawkins, which I think is affiliated with AMN Healthcare. And this report, it breaks it down by generalists, all physicians, and then specialists. All physicians on average, earn, according to this report,
Yeah.
earn $339,000 per year. It's a really nice number, right?
Yeah.
You could live really well on that, even with 500,000 student loans. On average, those physicians generate $2.38 million in revenue for the hospital.
And
If
this
you
is
get to
2019
specialists,
data. Yeah.
if you get to yeah, exactly. This is not
This,
out of the press. With
this
these
is
numbers,
average in 2019. Yeah.
the
Yeah.
gap
Wow.
is going to get, it would be wider if this
Oh,
was
I'm
in
sure. Oh, I know
2025.
the specialists make more. Yeah. Yeah.
So for specialists, on average, they report 355,000 on revenue of 2.45 million. And so when I sit down with physicians, I'll go back to this report often and say, do you have any idea how much you generate in revenue? It's not fair. And look, I know that there are pundits and people smarter than me who would say, well, the reason for that gap is academic, blah, blah, and they'd explain it away. I'm sure they would. But what I'm saying is, it's not about making it one to one. It's about closing the gap and making it more fair.
That's the word I keep coming back to when I talk with physicians, when I talk with our team at Off Call. Nobody thinks that, seeing patients is easy. We all know that it's risky and challenging and stressful, and we bring it home with us. We still view it as a privilege that we get to help other people, but it's really just about fairness. I spoke with Eric Bricker on the podcast.
I love Eric Bricker.
Eric's incredible.
Huge fan.
He's incredible. He said specifically, yeah, I think physicians should either threaten to or leave more frequently. I mean, that the idea that in any industry, whether it's healthcare or marketing or whatever, if you change jobs, the people that change jobs more frequently make more money. Ethan, a couple final questions here. We mentioned student loans very briefly. Are you working with physicians who have large amounts of student loans? Are you mostly with kind of new attendings?
I can count on one hand how many physicians I've talked to coming out of training who don't have six figures in student loan debt. Like, that is just, it's the expectation at this point. And I'm not, by any stretch of the imagination, I'm not a student loan expert. And just as a shameless plug, I don't get paid by these people, I have any financial relationship, but GradFin and Student Loan Debt Tutor are two really good companies that I've sent physicians to get help, or at least just get advice, like know what your options are. But where I do fit in is negotiating that into the physician's contract.
Huh. Tell me about that.
It's called education loan debt support. So typically what you'll find is one of two things happens. Either the practice, hospital, employer, whomever, will pay that money directly to the student loan servicer, or they'll pay that money to the physician, then the physician can pay off their loans.
Ethan, just in our last few minutes here, I've got a couple kind of rapid fire questions here for you. What's something we could do that would truly change and improve the system?
Tell your partners about your pay. Talk about pay at work.
Ethan, who are your other heroes or role models?
I'd say my mom is probably my biggest inspiration when it comes to how I interact with people. And like, I can be a little bit gristly like my mom sometimes, but it comes from a place of passion and affection. And so I'll lean into saying the difficult things to physicians when I know it's for their benefit.
What do you want to say about why physicians are valuable to society?
You don't have to look that far back to see physicians on the front lines of a global pandemic. So just think about how things would have gone without them. And yet, did they ever get a break? Did they ever get bonuses? Did they ever get any type of recognition other than maybe a couple of us patted them on the back, threw them a pizza party? But we don't have to look too far back to see how our lives or someone we care about's lives were impacted by a physician.
Thank you for saying that. Last and most important question, Ethan, who should hire you and how can they get in touch with you?
I will say very transparently, I'm not for every physician. The physicians I work with, one, they're in pain and discomfort, and two, they believe they deserve better. I always will tell physicians, there's no doubt that I can do what it is you need to be done. That's not at issue here. What's at issue here? The only thing that matters is, do you believe that you deserve better?
Ethan, where can people find you?
Yes, you did ask me that. We have socials everywhere. So we are mostly going by physician agency. So if you're on Instagram, TikTok, YouTube, LinkedIn, if you just search physician agency, I'm probably going to be the ugly mug that you see popping up.
Awesome. Awesome. Well, Ethan and Nkana, thank you so much. It's been an absolute pleasure to talk to you today. I really loved our conversation.
Hey, the pleasure was all mine, Dr. Walker. Thanks for sharing your platform with me.
Thanks for joining me today. For interviews with physicians creating meaningful change, check out offcall.com/podcast. You can find How I Doctor on Apple, Spotify, or wherever you listen to podcasts. We'll have new episodes weekly. This has been and continues to be Dr. Graham Walker. Stay well, stay inspired, and practice with purpose.